our path had happened back in 2016 when we started looking at life expectancy outcomes on the West Side. And we saw that there were big gaps. So if I was fortunate enough to live in the downtown area, my life expectancy was 85. If I lived in West Garfield Park, it was 69. And so health equity is getting at that. Like, how do we decrease that life expectancy gap on the West Side of Chicago through various initiatives? Our goal is to be a national leader in this space. You know, we've been so fortunate to be able to work with other hospitals, community-based organizations, and residents. And so doubling down on that work. Like, we have a multitude of initiatives that are going on in education and workforce development and in healthy food and also access to quality care. But then now with COVID happening, there are initiatives in that space too. And so my hope is that we continue to double down on that and bring in even more stakeholders to the work. There is an organization under the Rush umbrella called Equal Hope that was started, I think, a little over a decade ago, and it was founded on a data point that showed that African American women were dying from breast cancer at 2 or 3 times the rate as white women. And so a group of community organizers, hospitals, and other folks got together to close that gap. And when you look at that work and their success, they are the only organization within the city that's been able to actually reduce that gap as compared to other cities across the country. So I'm sitting here, as a person of color that has, family, that has, gone through a good education system, that's been really fortunate enough to have a quality job, that has great friendships, that lives in a relatively safe neighborhood. All of these things lead to better health outcomes for me and other people that are similarly situated. And so whether we're talking about poverty issues that are impacting people's ability to buy healthy food, or poverty issues where people have to travel really far to get to their jobs, and that has an impact on their overall health. Like, that's the kind of stuff that we're looking at when we're trying to even the playing field of opportunity. What makes a neighborhood vibrant? What makes a person vibrant? It's our ability to access all the things that people know, create a healthy life. Do my kids go to a great school? Do I have access to a great job? Can I walk in my neighborhood? Is it safe? Like, all of those things that create overall health and wellness. And that's the kind of work that we're doing at Rush.